Okay, let's start with a quick challenge. Take a look at this brain scan right here. Look closely. Can you spot anything unusual? I'll give you a few seconds to think. Now take a look at this one. Looks completely different, right? In the first one, things looked a bit darker. But this one, we're seeing bright white areas. And both of these scans are showing brain stroke. And yet, they look so different on CT. Why does that happen? Why is one dark and other one is bright? What's actually going on inside the brain during a stroke? And how can we tell what kind of stroke it is just by looking at a scan? In this video, we are going to break it all down in a simple manner. So watch the video till the end, and if you find it helpful, don't forget to like, share and subscribe. Before that, we need to understand one simple but really important thing. What exactly is a stroke? Just imagine this, your brain is like a huge power station. It never shuts off, it works 24/7 and it controls everything. Your thoughts, your movement, your speech, even your heartbeat. But here's the thing, it can't do any of that without one major fuel source, that is blood. Blood brings in oxygen and nutrients, and without it, even a few minutes of no supply and brain cells start to die. So, if blood suddenly can't reach the part of the brain, that part of the brain starts shutting down. You can think of it like a brain attack. Just like heart attack happens when a heart vessel gets blocked, stroke happens when a brain vessel either gets blocked or bursts. There are two main types of stroke. The first one is ischemic stroke, and it is the most common and it makes about 80 to 85% of all strokes. This happens when a blood vessel in the brain gets blocked, usually by a clot. Because of this blockage, blood can't reach the part of the brain, and without oxygen, the tissue starts to get damaged. In the early stages, the CT scan can look almost normal, so we need to look closely for subtle signs, which we'll see in the next part. Second one is hemorrhagic stroke. This happens when a blood vessel bursts and bleed into the brain. This type is usually easier to detect on CT because blood appears bright white, but it can be more dangerous due to brain swelling, midline shift and increased pressure. Before we jump into diagnosing stroke on CT, let's clear up some basic CT scan terms that you really need to understand. Once you get these, the rest becomes super easy. So when you look at CT scan, you'll notice some areas are dark, some areas are grey, some look really bright. And that's not random. Each of those shades tell us something about the tissue inside the brain. See, CT scan works by measuring density, how much X-ray is absorbed by a tissue. And that's measured using something called Hospital unit or HU. Let me make it super simple. You can see the HU value chart here. Each part of the body has different HU values. It depends on density of the tissue. If the tissue has more density like bone, it can go around 1000. And if the tissue doesn't have any density like air, it can go around -1000. And likewise, water is around 0, brain tissue is around 30 to 40, and the most important, acute blood, it has around 50 to 60 HU value. If the HU value is high, it looks hyperdense, and if the HU value is low, it looks hypodense on CT scan. So when you say something is hyperdense, we mean it's whiter than it should be, like fresh blood or clot. If it's hypodense, that means it looks darker, fluid, edema or impacted brain tissue. Okay, now that we learned some CT scan terms, what hyperdense and hypodense is, and how HU value works, and what to expect on a normal scan. So let's see how to spot stroke, especially on ischemic stroke, which can be tricky. Now remember, ischemic strokes don't always show up on CT scan, especially in the early stages. There will be subtle, slow changes that you can miss if you don't look carefully. So here's what I do when I open brain CT for stroke. First thing is, I always compare both sides of the brain. Because the brain is mostly symmetrical, if one side looks different from the other, even slightly, that's your clue. One of the first things you might notice is a slight darkness in the area where the blood supply is blocked. It's not jet black like fluid, just a bit more grey or dull. That's the tissue starting to suffer and it's swelling, getting softer and losing structure. In normal scan, we can clearly see that the grey matter looks slightly denser than the white matter. On CT, grey matter appears a bit brighter, white matter is a bit darker. But during a stroke, this contrast fades. Both layers start to blend together. We call this loss of grey and white matter differentiation. Now pay attention to the sulci. In the healthy brain, they are visible like small spaces between the poles. But when there is an impact, the tissue swells and those sulci start to disappear. And that's called sulcal effacement. And it's one of those early signs you don't want to miss. Sometimes you might also spot the bright line running along the path of the middle cerebral artery. It stands out more than usual. That's a clot sitting inside. We call it the hyperdense MCA sign. And it tells you there is an acute blockage there. These are the most important signs your eyes are looking for. So you should always look for these signs when you're looking at a stroke on CT scan. Okay, now let's look at hemorrhagic stroke. This means there is bleeding inside the brain. And the best part is, it's usually easy to spot on CT scan because fresh blood looks whiter on CT scan. So if you see the part of the brain that looks suddenly bright white, especially when the rest of the brain is grey, that could be blood. Now, where can this bleeding happen? Let me show you with simple examples. If the bleeding happens inside the brain, this is called intraparenchymal bleed. You will see white patch inside the brain. This kind of bleed often happens with patients with high blood pressure. You can get different types of bleed depending on the shape of the blood. Subdural hematoma. It looks like crescent shape along the brain's edge. And these both are mostly seen after trauma or head injury. And if you see hyperdense in sulci, this is called subarachnoid hemorrhage. It often happens when a blood vessel bursts suddenly, like an aneurysm. So that was all about how to read CT scans for stroke, from ischemic to hemorrhagic, and all the clues you need to spot them. And if you made it this far, I got a small challenge for you. I'll show you a CT image on screen. Pause the video, take a close look and tell me in the comments, is it an ischemic stroke or a hemorrhagic stroke? And if you enjoyed this video, don't forget to like, share and subscribe. And thanks for watching and see you in the next video.